Robot Talk is the podcast that sits down with robot enthusiasts from around the world and asks them the questions you always wanted answered. Like, is that a microscopic robot? And how does that thing work? Hello everyone, welcome to Robot Talk. I'm your host, Claire Asher, and this week's episode is about surgical robotics. I'm finding out about the latest advances in robotic surgery that could solve some of the most difficult challenges in modern medicine. Before we get started, I'd like to invite you to join the Robot Talk community on Patreon, where I'll be sharing behind-the-scenes updates, and you can chat with me and other Robot Talk listeners. You can also sign up to support the podcast for just £5 a month. And if you do, not only will you get a warm, fuzzy feeling for helping me to keep producing and expanding the podcast, but you'll also get access to exclusive bonus episodes and lots of other cool perks. Check out patreon.com/Claire Asher to find out more. The first 20 Patreon supporters get a free sticker, so don't procrastinate, join today. So, with all that said, it's time for me to introduce this week's guest. I recently had a fascinating discussion with Christos Bergeles from King's College London about microsurgical robots to deliver therapies deep inside the body. Today, I'm chatting to Christos Bergeles, a professor of surgical robotics at King's College London, working on microsurgical robots that deliver regenerative therapies deep inside the human body. Hi Christos, welcome to Robot Talk.
Hello Claire, pleasure to be here. It's a big honor to be invited.
So you direct the Robotics and Vision in Medicine lab at King's College London. Can you tell me a bit about the research that's going on there?
Certainly. So our vision is that machines and robots can augment the physical and mental capabilities of surgeons. The idea is to help surgeons not only do what they can do a little bit better, but to kind of push their boundaries and achieve currently impossible tasks. So we're looking both at the development of new types of surgical robots that can have micro precision, perhaps patient specificity, sensing, but also their associated intelligence. And a big push is to create technology platforms that not only go to inspect, but also have some sort of theranostic capabilities. They can give you an understanding of the state of the tissue or deliver therapies deep inside the human body. So the idea is to be able to access the body in a very localized fashion and assess and treat diseases right there on the spot.
Amazing. Yeah. The advances in surgical and medical robotics are definitely some of the most mind-blowing and, I guess, impactful that I hear about.
Yeah, indeed. I mean, surgical robotics have started being ever prevalent in hospitals. There's a very strong research, a very strong commercial interest. So it's a very, very good time to be embarking in this type of research. And what we are doing is we're trying to create the systems of like the next decade. So not systems that are rigid, but systems that are soft, systems that are flexible, that can go inside the human body. They can navigate very small lumen. And the key characteristics is systems that have some sort of physical intelligence. So they have morphology that adapts to the patient, that provides sensing feedback, in addition to the artificial intelligence which comes like from powerful computers and data.
Right. So like I've talked before to Helmut Hauser about this concept of morphological computation. Is that kind of what you mean?
Yeah, exactly. So depending on how you approach it, you can call it either physical intelligence or morphological computation, but it is can the structure of your system, the materials of your robot, the characteristics, the architecture, give it with the ability to do some low-level actions without you requiring to have a computational powerhouse behind it.
Yeah. And one kind of quite remarkable project that exemplifies some of these ideas that you've been working on is a microsurgical robotic system to deliver stem cell therapy to the retina of the eye. So can you talk a bit about this project?
Yeah, we have a few big projects in the lab. This is a project that has been running for the longest.
Okay.
And what I like about this project is that it brings together a very challenging engineering problem, together with a very challenging clinical problem, and a very challenging biological problem. And this is really a three-way collaboration between a strong clinical support from Moorfields Eye Hospital and biology from UCL. And we have like three pillars in this project. What we want to do is to be able to go back inside the eye in regions that have degenerated and through extreme precision insert and inject therapies. So the specific example we're looking at is age-related macular degeneration. This is a disease that affects many hundreds of millions of people worldwide with high prevalence when you're over 65 years old. So, and it's also a congenital disease. So you either have it or not.
Yeah.
Now, in age-related macular degeneration, there is a tiny part of the eye called the macula, which starts degenerating. So its cells die. You have like leaky vessels, you have loss of function. But because this function is lost, in order to regain sight, you need to go and redeploy the cells that provided this function. But now we're talking about cell level surgery. And so this is impossible to be done by hand.
Yeah.
So yes, there are therapies based on stem cells that you can differentiate to go back and make them such that they become the cells that are missing. That's already very hard, but our biology collaborators have found ways to do it. But actually going and doing it by hand, it's impossible. So that's where robotics come in. They give this sort of micro precision that allows these cell therapies to find their natural location inside the eye.
Right. So the stem cells need to be applied to this very, very precise location in order to kind of work.
Yeah, exactly. They need to be orderly. They need to be among their friends, their cell friends, so they kind of realize their function.
Yeah.
And that's the reason why many of these therapies based on viral vectors and stem cells, it's very hard to deliver it precisely. And if it's not delivered precisely, then it doesn't have the impact that it's supposed to.
Yeah. And so what stage is this project at the moment?
So we've been working on this project for 10 years through a variety of research grants and philanthropic foundations. Our main ambition is to create a robotic system whose tip acts like a micro-sized Da Vinci instrument.
Right.
So you are within the eye, and the eye is like a couple of centimeters in diameter. And there you need to have micro-scale precision, but you also need to be able to have some control of both the position and the orientation, because you need to do injections. So, and imagine if you want to do an injection, let's say in your arm to draw blood, you need to go under a nice angle to kind of puncture it and not come out from the other side. So we want to offer this capability to the surgeon. That's the big promise. We are now at the stage where we develop our system under an ISO certified quality management system. ISO 13485. And this means that we want to submit to MHRA a request for approval for a first-in-human evaluation of a subset of the functionality of the system.
Right.
So, we are progressing towards our goal to evaluate it in a real clinical setting.
Amazing. I mean, obviously, this is the kind of thing that takes quite a long time to develop and test, and you want to make sure that it's 100% safe and effective before you start using it in the clinics.
Correct. There are specific standards you follow, risk-based medical device development. But I think what's exciting is, these are unknowns in an academic setting. We don't normally do that. We do research, we publish papers, and then suddenly it's this entire new world. Which we get exposed to, which I think is fascinating as well. Yeah,
absolutely. For listeners who might not be familiar, you mentioned the Da Vinci robot. That's a surgical robot, one of the original surgical robots that's been around for quite a while now.
Yeah, indeed. Is I think the most well-known surgical robot. It is used for laparoscopy, soft tissue surgery, so that makes it different. And I would say it has been an enabling technology in terms of the ambition that we have as researchers as well.
Yeah. So your research lab in the title has the word vision. So how are advances in computer vision contributing to the development of more precise surgical robots?
So we use computer vision as the mechanism to endow surgical robots with a perception capability.
Mm-hmm.
So we have the images from the microscopes or from the endoscopes. We have a plurality as well of other type of data like models or sensors that could complement image information. But ultimately, you want to go from getting just the raw images to understanding what is in the images, like perceptual analysis. This is an instrument, this is the vasculature, this is the layers you want to target, to cognition and to extrapolating decisions, right? So then you can go towards robot autonomy.
Yeah.
So the idea is that through computer vision, we create certain autonomous functions, we enable certain autonomous functions in our robots that support the clinicians. For example, if you want to do therapy delivery, be that in the eye or another part of the body, you need a very slow diffusion rate. You can't just jump the injection in and squirt it in. You need to do it over like 10 minutes.
Okay.
And having a stable hand over 10 minutes at the micro scale is impossible. But if you had a robot that sees how the patient tissue is moving, it would auto-stabilize.
Right, because it's not just the surgeon that has to stay still, it's the patient as well. Breathing, and we're always just slightly moving.
Exactly. So eye surgery specifically happens with awake patients under local anesthesia, sedation, but still awake. So there are small motions aside from breathing. And this is what, computer vision can enable us to do. Understand the motion and help the robot compensate for it.
That's, incredible. So we have an audience question from Marianne on Patreon. Marianne says, if surgical robots could learn from every operation they perform, what ethical considerations arise in terms of data ownership, patient privacy, and the robot's evolving decision-making autonomy?
That's a fantastic question. And it speaks to the fact that there are now people that are, and academics that are trained specifically on the ethics of surgical robots, on data considerations. So ethics used to mean, am I allowed to do this or not?
Yeah.
But ethics now increasingly means like, how can I use the learnings of what I have? How will this inform autonomy and so on? And there's a legal framework being put in place as well, on AI, on generative AI by the EU. So it's a very pertinent topic. Now, for example, if we look at data ownership, that's a big one already.
Yeah.
So in the UK, the NHS has the data, right? So we are in theory able to acquire the data with permission from the patients to do research. When it comes to commercial exploitation, though, where do you draw the line, and what will the NHS Trust ask in return? Will they be a partner? Will they have shares in that company? And then you will have the voice of the patients as well. Like, well, actually, these are my data.
Yeah.
So how can you exploit them? Which is, for Facebook or Meta, these conversations have started. Like, these are my data. Now, the data as a single unit, my own data, actually holds trivial value, the same way that it holds trivial value for Google.
Yeah.
So it is an interesting discussion, like where do we go next on that? Definitely.
Yeah.
And in terms of the decision-making, I think that's also then carries the implication of who is responsible. Because suddenly autonomy means that responsibility is with the surgical robot, which means with a manufacturer rather than with a user. So what insurance will be there in place? I think this is definitely a very important conversation to be had.
Yeah, absolutely. And yeah, like you said, it's a bigger conversation than just surgical and medical robotics, but I guess people often feel particularly protective over their medical data.
Of course, privacy concerns are rightly much stricter. But it's something that we would need to discuss collectively because it's heading very rapidly that way. Yeah,
absolutely. So you mentioned that you're working on like a number of different projects. We've talked about the stem cell retina project. Do you want to talk about any other specific projects you're working on at the moment?
Yeah, definitely. So along the same lines of creating platform technologies that enable the delivery of therapies in the body, we have a very big European project which looks at creating new types of catheters.
Okay.
So we want to create catheters that navigate inside the body in a different way, like they are unfolding inside the body rather than being pushed. And this unfolding means they can take the turns of the anatomy in a more intrinsically safe way. And this is coupled again with image analysis. We have some partners that are working on Alzheimer's therapies and creating biologically degradable scaffolds. So again, this combination of engineering, clinical need, and biology is the area that the team is working on.
Yeah, it's fascinating, I guess, both from like the technical challenge of it, but also knowing that it's something that's really going to make a difference to people's lives.
100%. And surgical robotics and medical engineering in general is one of those fields where impact, even though you can't reach it, it's not like it's immediate. It's very clear. So it's clear why you're doing what you're doing. It's clear what you can achieve. Now, whether you will achieve it or not, it's another question.
Yeah.
But it is very easy to make the leap from what you're doing now in your lab to the impact to society conceptually. And I think this is very powerful and very motivating.
Yeah, definitely. So you've also been involved in a number of public engagement events. So how do members of the public respond to hearing about these kinds of advances in surgical robotics?
Yeah, so we attend a few public engagement activities. We have been at New Scientist Live over the years. That's like 10,000 participants over 4 days. The Royal Society, again, similar numbers. There's Summer Science Exhibition. I think it is very interesting, the range of opinions you're getting and the range of feedback. So you have the younger people, which wouldn't even necessarily blink. This is a robot. Okay, move on. Yeah. I've seen that, There is the older people who are, wow, did I already have surgery with one of those? I didn't even know, this type of thing. And there are the in-betweens who would like to learn the extra information and to provide feedback on how information should be presented. I think what we have learned is to co-develop with the public and the patients the type of information that we give out, so that it is clear, so that it's not full of jargon. And this kind of helps us as well verbalize our mission and our vision in a way that also the team understands it better. Yeah. But we have heard people that they don't want to hear about surgical robots, and people that are like, bring it on if that's what the clinician says is the next big thing. Yeah.
Yeah, I can imagine there's something quite, I don't know, scary or unnerving about the idea of being operated on by a robot. But then that's kind of illogical, because if they can be more precise, if they can be safer and more accurate, then that's better for everyone.
True, but what we've also found, and in a very recent consultation with patients at Moorfields, is what we as academics call a robot could have a wide definition. Like, our robot is not a robot like a humanoid robot or like a dog robot. It's just a tool. It's a smart surgical instrument. And immediately when we called it smart surgical instrument, we're like, yeah, okay, that's fine. Yeah. Like, that's what we've been saying. So no, that's not what you've been saying. We're saying a robot, and robot is a Terminator or whatever. Yeah. So I think this helps us ground a little bit the way we talk to people. Yeah. It's fascinating. And, it's very nice to be able to engage with people and to show them where their taxpayer money is going to as well.
Yeah, absolutely. And I think so many scientists often think of public engagement as like, I'm going to tell you about this fantastic new development, but like that two-way conversation where you're taking on board their feedback, I think is so important.
Yes, and that's funding bodies are pushing for this now, and rightly so, to help us also incorporate the feedback and help it shape the next steps of the research. Yeah. And there was one excellent example I give, and I don't. It's from Dana Damian. She's over at Sheffield. They make ingestible capsules. They run an activity like that. And one of the questions that arose is, okay, it's small, it's big, what's the flavor? And you're like, okay, that's a very valid point. Yeah.
But not something you probably would have ever thought of.
Exactly. Yeah, exactly that.
Yeah, brilliant. Christos, it's been great talking to you today. I've been speaking to Christos Bergeles from King's College London. Thank you.
Thank you very much.
Thanks for listening. If you enjoy Robot Talk, I'd really appreciate it if you could share the podcast, subscribe, and leave a review. It really helps boost the podcast, so thanks in advance. And make sure you check out @RobotTalkPod on social media to see a photo of a surgical robot for delivering therapies into the eye that Christos and I talked about. Next week, I'll be chatting to Isabella Fiorello from the University of Freiburg about soft robots inspired by plants. Until then, I've been Claire Asher, and this has been Robot Talk. Robot Talk is brought to you by the Hamlin Centre, Imperial College London.